Once you have this mass you've discovered, you've in a relationship with your healthcare provider, you've made a provisional diagnosis based on the imaging studies. You think it's a benign tumor because it's behaving itself and it doesn't have any scary features, no deficits, not a lot of pain. Then you have the option of either observing the lesion, in other words, getting an MRI scan 3 to 6 months later, make sure it's not growing quickly, and then maybe every year or every other year after that, and then making some decisions. I have a lot of patients who show up with nerve sheath tumors that are asymptomatic or minimally symptomatic. They're small, they're not scary looking, they don't grow very fast. And a lot of times, together with the patient, we both agree that, maybe we shouldn't operate on this because surgery has some risks. And if the lesion's small and not, misbehaving, then we can just watch this. And we can watch these lesions indefinitely as long as they're not getting too big or getting too symptomatic. And that usually consists of getting an MRI scan. And sometimes these lesions don't grow or they grow really slowly. And sometimes on an interval imaging scan, we see a lesion gets a little bit bigger. And maybe, if we're watching a lesion for a few years and starts to really get bigger, sometimes patients really want to have it out, both to get a diagnosis and so they don't have to worry about the lesion anymore. In other cases, these lesions get big enough so they start pushing on the nerve or sticking out, or the patient starts bumping into them. And that can lead a patient to want to have the lesion out. But that's a conversation you're going to have with your doctor, depending on your individual circumstance. But just understand that just because you have a tumor doesn't mean you need surgery.